When we look at healthcare outcomes across the country, Indiana generally ranks below the national average. For example, in 2022, the United Healthcare Foundation ranked Indiana the 35th healthiest state overall. And then when you dig into Indiana's healthcare outcomes county by county, you find that the counties in East Central Indiana are among the least healthy in the state. You might be tempted to think that areas which spend more money on healthcare will have the best healthcare outcomes. But in fact, it's the exact opposite. Health is Wealth is presented by Meridian Health Services, with support from LifeStream Services. Dr. Michael Hicks, professor of economics at Ball State University, told me Hoosier per capita healthcare spending is actually higher than the national average, and East Central Indiana is higher still.
When you have worse healthcare outcomes, the presumption is that spending alone will fix that, but it's a very difficult problem to disentangle because part of the worse healthcare outcomes are that people are spending their healthcare dollar on the wrong thing. Instead of getting early intervention, wellness care, that sort of thing, they defer their healthcare until it's an acute problem. And so stage 1 breast cancer becomes stage 3 breast cancer. A small curable type 2 diabetes becomes full-blown problem with vision, and that's more expensive. So when you have worse healthcare outcomes, the private spending may be lower, but the public cost is higher.
So lack of preventative health care is one of the reasons East Central Indiana has such high healthcare costs and such poor healthcare outcomes. But from the perspective of an economist, this is a multi-layered problem. 2 additional interconnected challenges. This is largely a rural region, and it's one with high rates of poverty.
The more rural we are, the nodes of healthcare access are less evenly spread across the population. In this Affordable Care Act market region, we have 3 hospitals, one here in Muncie, one in Blackford County, and one in Jay County, all owned by the same hospital chain, and those are the nodes for other physician services. So they're going to be closely surrounded by them for a variety of reasons. And so if you're not living in one of those areas, it's more difficult to access a hospital. And if you're poor, and if you're already in poor health or have poor chronic healthcare outcomes, that makes it more difficult for you to access transportation to get to where you need to go, or child care, or care for an elder parent or a spouse. And so the factors that tend to make it more difficult for you to get to a physician's office for a wellness check, or to diagnostic services at a hospital on an outpatient services basis, are the same things that make you unhealthy in the first place, or are less likely to seek treatment. And so they just build upon one another. And so you start getting a case of, out-migration, or healthy people leaving, so the incidence of disease is higher.
And that out-migration is exacerbated by another challenge this region has faced over the past several decades, what an economist calls economic shocks.
What happens when a number of jobs leave, either because the factories are automated and the work is consolidated somewhere else, or the jobs are outsourced to production overseas. That will often leave a region losing, particularly here in the Midwest, losing 20,000, 30,000 jobs in a county of 100,000 people over a decade or two, which is what we've observed in Muncie. It's happened in each of the counties we've had in the East Central Indiana. And what that does is, again, exacerbates the problems. There are the people who can move out, move away. They find employment elsewhere, they adjust, and they're fine. That's part of the adjustment process to labor demand shocks. But then some people can't move, either because their spouse has a job and they can't afford to, or they just don't have the human capital or savings to make the move. And those folks tend to have, as we observe, worse healthcare outcomes.
When people move away during these economic shocks, the overall health of the community gets worse. Here's why.
Think about just a bell curve of health. There's some people who are super healthy and some people who are super unhealthy. Most of us fall in the middle. And then there's an economic shock, and half of people randomly lose their jobs, but a third of the healthy people leave. Then the average health is going to drop because you're losing that top portion of it. And so if they leave and they're not replaced, that tends to cause more problems.
You may have heard the phrase brain drain before, which refers to people with higher education levels moving to places where there are more job opportunities. Just like with economic shocks, brain drain worsens the overall health of the community.
And so when there's brain drain from a region, when people leave, the ones that are healthy and better educated leave first, leaving people who are less well educated and less healthy behind. And the reason that the health is connected to education as well is that better educated people will make more money. They can afford doctor's visits, wellness checks. They have the opportunity and the ease of getting to the physician. So it's tied up with the poverty problem here as well, or at least low incomes, if not generally just a poverty problem.
So healthcare is closely interconnected with other challenges like poverty, education, and geography. With such a complex problem, any solution will need to be complex too. But a key part is preventative care.
Some work that I did in West Virginia where, just as a good example, a mammography machine broke. And I was asked to come in and take a look at the data over a 2-year period when the mammography machine broke. And so this was in a remote county with 30,000 some people in. People stopped going. It was the only mammography machine in that county. And then immediately after the machine was replaced, it was about 9 to 10 months, there was a spike in both detections of new cancers and people accessing the service. So there was a big drop off when the machine broke, flatlined, and then spiked afterwards. And so that shocked me as a young economist. But what it spoke to is that while women were still identifying symptoms of breast cancer, but they were unable to go drive that hour. They couldn't get childcare. They had jobs that wouldn't allow them to release. They didn't have transportation to go there. They were afraid or uncomfortable with doing that. So to an economist, it's an access issue. If you get into the provider's office, if you get with a wellness specialist, if you're able to go to that wellness checkup, then the physicians are doing a good job trying to build those healthy habits. But if the access is unavailable, if people can't get to the service, if they don't have the diagnostic equipment, that's really where the breakdown occurs.
We talked about the poor health outcomes in our community and the way that factory closures, brain drain, and poverty have created a vicious cycle that's really hard to overcome. But to an economist like Michael Hicks, focusing our public health dollars on preventative care can move the needle in the other direction, even reversing the vicious cycle to create a virtuous cycle.
And this is not, broad socialized medicine. It's just helping people be more well, better off. That makes them more productive in society, less likely to use public services, more likely to pay taxes, more likely to have healthy family members, more likely just to produce more at work and have an employer that's excited for them. It's a virtuous cycle, and it's good that Indiana is stepping up into that. And it's the most hopeful thing, I think, for the healthcare outcomes in the state that we've seen in more than a decade.
Hey, you're still watching, so like this video and subscribe to help us produce more local content about East Central Indiana. In the next episode of Health is Wealth, I try to figure out why the cost of a hospital procedure can be so different just 30 minutes down the road. Thanks for watching. I'll see you next time.